morning.
Good morning.
Okay, a lot of questions about the enterovirus. One coming from Rebecca, wanting to know if adults need to be worried about this.
It's primarily, well, actually the virus can happen to adults. There's a lot of adults who have had it, but they probably didn't know it. It just seemed like a regular cold. And it's really not that different from the common cold. There's so many variations of a cold, different viruses that cause it. This one just seems to have had kind of spread like wildfire, and now we're finding out that maybe there's a connection between this and some other things that are happening, like the 9 children that they're evaluating in Colorado right now who have arm or leg weakness. And there are other viruses that do that. There's an infection, and after the fact, usually it's an immune response. Your immune system kind of gets confused and accidentally attacks maybe part of your own body. In this case, maybe it's gray matter in your spinal cord that causes some weakness somewhere or another. So really, adults don't have to worry about it too much. If you had a child that had a respiratory illness and then all of a sudden has weakness in an arm or a leg, that would be something that's of concern and should bring to your doctor right away.
Okay. I like that. You knocked out 2 questions with 1 answer. Very good.
Oh, wow. Okay.
Knocked out Casey's as well. Moving on to cold and flu season now. Kristen is wondering what risks and things are involved in getting a flu shot. I haven't had one in more than 10 years, and she's nervous about getting one.
Sure. A lot of people think that they're going to get the flu. So about 10% of people that get a flu shot actually do feel some muscle soreness or almost like flu-like symptoms, although it's not the flu. The symptoms of the flu are actually they're not actually caused by the flu itself, but your body's immune response to them. It raises your temperature to fight the infection more favorably. It causes muscle soreness because of cytokines and different kinds of chemicals that white blood cells release when they're trying to fight infection. So that's actually pretty normal. There could be some soreness at the spot. You can get a preservative-free shot as well nowadays.
Okay. And who would want to do something like that? Well,
I guess there's always a question of, so there's this thing about vaccines and do they cause autism and do they cause problems? There's a philosophy out there that a very robust immune response to whatever it may be, whether it be a virus or possibly even vaccines, could cause collateral damage, so to speak, in your body somewhere, and that could cause disease, like autism. Never been proven before, but some people feel like that's a risk, so they would go with the preservative-free. And I think that's reasonable, but since the preservatives have never really been linked with anything, I think it's safe. I use that. It's okay with me to use with my kids.
Okay.
But, you know, if someone who's just really concerned about it.
Okay, another option for them.
Yeah. Or if they have an allergy or reaction to other preservatives in the past.
Sure. Okay, this one is coming from Joe. He broke his ankle in February, and he wants to know if it should still hurt. Also, should he do physical therapy? What does icing really actually do?
Okay. Well, I'm assuming that he saw the doc at some point and maybe had a cast or something like that. Ankles take a while to heal in terms of pain especially, even though the bones have fused together still. There still may be a lot of pain after the fact. Physical therapy is a great idea. A lot of the Achilles tendon may shorten because you're not moving the foot as much, for instance. So you got to stretch that out, strengthen the muscles surrounding it. So physical therapy does help a lot. And I would say, yeah, he should probably, if it's still hurting at this point in time, it would be valid to go back to the doc and just say, maybe physical therapy could help me get better here and get a referral.
And what about his question as to icing? What does that really do? And at this point in the game, is that something that's really going to be helping him?
Sure. Icing typically is in the setting of inflammation. So after the break, if there's swelling, that type of thing. Now, it could be the case that when he exercises, he still has swelling right now and it hurts. If it gets puffy, it's red. That would be very appropriate to use ice for that situation. If that's not the case, icing is not going to help with the inflammation so much, but it might help with pain control. Sometimes it's not really temperature confusion, but sometimes that helps people with a little bit of pain, and you can do it off and on, and you can use heat as well. So in the setting of inflammation, I would say definitely if 9 months or 6 months out or whatever it is at this point in time, it may have kind of limited usefulness for him.
Okay. Last question this morning. Alex wondering, how can we prevent our kids from getting the hand, foot, and mouth disease?
Well, that's a virus, just like many other viruses, and it's given through hand contact, so it's careful hand washing. Really, it's the same answers to all the virus questions.
I was going to say, we hear that a lot, but I mean, that just proves how important it really is for so many different things.
Yes, exactly. It's what we call fomites, so it's just an inanimate object. Somebody coughs on it, you touch it, you put it to your mouth, and then all of a sudden you get hand, foot, mouth disease. Not fun. So careful hand washing, especially in the winter months.
All right, yeah, and as we go into flu season as well.
Absolutely.
Dr. Walker, thanks so much. We've got more of the morning show coming up next.